that it's still happening, putting those most vulnerable at risk.
Let's bring in Rod Maloney. Rod, you spoke to the daughter of a nursing home resident going through this. Understandably, she's terrified.
And that among other emotions, Kimberly, and it's one of those situations where she was watching yesterday in the governor's news conference when I asked the governor about her policy of putting COVID positive patients in the same building as COVID negative. She was upset then. She remains upset tonight. Her name is Kellyanne Carlson.
I most definitely fear for my mother's life.
Kellyanne Carlson's mother, Esther McGordon, is 87 years old, lives in a southeast Michigan nursing home that Kelly says accepts COVID-19 positive patients. She's not been able to visit her mother, who is not COVID positive, since the crisis began.
It's the most difficult thing I have ever been through in my life.
Kellyanne says she and her husband have written to the governor pleading with her to change her policy. A form letter back did nothing to make her feel better.
I'm terrified she is going to get the COVID, and I will never see her again.
Throughout, the governor has defended her policy, her administration saying the original plan to send nursing home patients to the TCF center never materialized, apparently because it wasn't set up for long-term care. Now the governor's changing her tune.
We, I think have learned a great deal in the last 10 weeks. I think that if we could go back in a time machine and do some things differently, sure, there are things that we would improve upon. But every action we took was based on the best science and the best information available to protect people and to save lives.
But her administration's also admitting some 30% of our 5,500 COVID deaths have come from nursing homes.
She has the total authority and ability to change that now and not have my mother and other people's mothers and fathers go through a living hell wondering when you're going to get the phone call.
So Kellyanne Carlson thinks that the governor should be looking at taking COVID positive patients, putting them into a separate facility. That was certainly something that had been talked about a long time ago, but it doesn't appear that that's in the cards for now. In the meantime, the legislature is working on legislation that would force the governor's hand in not allowing COVID positive patients in with the COVID negative. Back to you.
Well, this remains an area that is still so confusing to many about the way we've responded, Rod, not the least of which, as you mentioned, legislators. We saw Senate Oversight Committee hearings. Have we got any other hearings scheduled now?
Well, not this week, but I'm told that there's going to be another one next week, and they're going to be demanding the numbers from the state because so far the state has not given accurate numbers that, by their own admission, the numbers were low counts, and so we'll be looking to see if they've got those numbers.
Yeah, we sure will. All right, Rod.